Thank you, Canada. Thank you, folks, for coming out. I have had my heart in Canada the entire pandemic, and I'm like Zuby. I've been watching. I watched with absolute horror what happened in 2020. I watched pastors get dragged and arrested for having church. I saw people not allowed to go fly or do any public travel because they made a medical decision that the public authorities didn't like. I saw authoritarianism that I never thought I would see in a place that I've long admired like Canada. And it is good to be on the other side. It's good to be in public with you all, celebrating that we are through this, but we actually have a long way to go. And I wanted to spend the time that I have telling you a little bit about my ideas about what happened and what we can do about it going forward. And I want to start at the beginning. And the beginning actually is not 2020. The pandemic started at least 20 years before that. It started with a utopian vision by a relatively small group of scientists that none of us voted for, that made decisions that very likely led to the pandemic to begin with. In 2003, there was the SARS pandemic, the first one. In Toronto, actually, there was an outbreak of it, and people were very alarmed. There was a new bat coronavirus that had made the leap from bats to humans in 2003, causing some deaths. The scientific community was absolutely alarmed because we didn't see it coming. And the American government, the European government, the Canadian government, Western governments everywhere decided to undertake a program of research to identify pandemic threats around the world in collaboration with the Chinese government and ask whether those viruses, those pathogens that are sitting in bats, in animals in the middle of nowhere, do they pose a threat to humans? The utopian vision, articulated by men like Tony Fauci in scientific journals, if you go back and look, was that we could rid the world of all future pandemic threats. We could rid the world of every single possible pandemic threat. Science had it in it to protect humans from all threats that surprised us. We'd just been through in 2003, if you go back 2 decades before, Dr. Drew mentioned this, the HIV pandemic, which surprised everybody, right? It was a new virus that had caused tremendous deaths and suffering. And the promise was that we could use science to make sure that we never face that threat ever again. And so we started a research agenda that went to the wild places, the bat caves of China. I'm not picking up at random. They actually went into the bat caves of China, brought viruses and pathogens out of those bat caves into city centers to do research. The research that would mutate those viruses and pathogens with an eye toward infecting humans better. Now you're saying to me, I can tell, I can see in your eyes, wait a second, I just told you that we have a utopian vision of protecting people from this. How does making the viruses and pathogens more infectious protect humans? You guys are puzzled as I am, right? Okay, let me tell you the story they told everybody, that they told the small number of people that were paying attention. What they said was that if we can mutate these viruses, and we can ask how many mutations are needed in order for it to make the leap to humans. If only a few mutations are needed, well, that pathogen poses a risk. If it takes a lot of mutations, well, we can just ignore them. There's never going to infect humans. So what they did is they brought these pathogens, and then the next step, let's prepare vaccines and countermeasures in advance for every single possible threat in the wild. You go to pharmaceutical companies, say, make vaccines for this thing that has never infected a human, and they'll do it. And stockpile them. So if this threat actually does emerge into the human community, then we will be ready. We'll have countermeasures available. And so that was the plan, and this plan goes back 2 decades. The problem with this plan is, like with all utopian plans, there are things that happen that are entirely outside the control of the scientists and the people that make these plans. And what very likely happened is, in the middle of doing these kinds of experiments, the virus in 2019 made the leap not from a bat to humans, but from a lab that was conducting research on the virus to humans. And it very likely made the leap in China, but it wasn't just Chinese authorities that are responsible. It's American authorities, it's European authorities, it's Canadian authorities. It is a worldwide effort. And the reason I've taken this long to tell this story is because it makes the thing that we have to do morally complicated, right? These are not necessary. I mean, there are lots of bad actors involved. I'm not going to sugarcoat. But the central idea was protection of the public from all pathogens. They had good at their heart, and they did evil, which makes the revisions that we have to do the reforms we have to do much more difficult. If it was just pure evil, if there was just a single bad guy, you can say that's the bad guy. If we could scapegoat, it would make life much easier, but we cannot. Right, so we have the pandemic starts very likely as a result of very, very dangerous research and in 2019 it makes the leap into humans and starts to spread, first in Wuhan and then everywhere. Okay, you remember those early days of the pandemic? Remember how scared everybody was? I mean, it's not that scientists are immune to this. Scientists also were scared. And when I first heard of the virus, when I'm scared, this is, I don't know if you all would do this, but what I do is I go hunt the medical literature. That's my usual reaction to being scared. So I went and I said, okay, what do we know about coronaviruses? What do we know about this particular one? What reactions are there? I was scared for 30 seconds because it was very, very clear to me. You can look at here's the thing. I don't really care if I die, but I really care if my kids die, right? So I looked at the numbers, and it was very clear that children were very, very low risk from this virus. That was very clear from the very earliest days of the pandemic. You could look at the data coming out of China. If you look at there was a cruise ship that floated around with remember the Diamond Princess cruise, and almost all the deaths were people over the age of 70 or 80. It was very clear that this virus posed a real threat to older people, but not a threat to young people. And so, to me, that pointed to a very clear thing we ought to do. Let's try to protect older people as best we can, but let's not harm young people. This is the earliest days of the virus. I watched with horror as country after country copied the Chinese model of what to do with the virus. The Chinese model was violations of civil liberties at scale. The Chinese model, in fact, the central ideology of the Chinese model of the virus was that we are all biohazards. Humans are mere biohazards that we should treat each other as In fact, that's the ideology of the lockdown to begin with. It has no place in public health. And I watched with horror as people that I thought were good, responsible people adopted that idea as a virtue. The idea that we should treat our neighbor as biohazards is the central ideology of the lockdowns. It motivated everything. 6-foot social distancing, physical barriers so that we don't breathe on each other, shutting down church services, shutting down businesses, shutting down schools, not letting kids play with each other, putting yellow tape around playgrounds, which I'm sure saved hundreds of thousands of lives. What you had was an entirely non-scientific approach that had never been used to manage pandemics in a century of pandemics, adopted by the entire world, because the World Health Organization looked at what China did and told the world in January 2020 and February 2020 that what China did worked. Just like Dr. Drew had said, that somehow we'd gotten to zero entirely implausibly. I'll tell you, treating our fellow humans as biohazards is not good for our health. It has never been good for our health. We are not meant to be alone. That's from the very, very first book of the Bible, the first words almost of the Bible, where we're not meant to be alone. We are created to love each other, not to treat each other like biohazards. So, okay, so again, I don't know what you all do when you get frustrated. I try to do science. At least I once upon a time did. I used to. Okay, I've never published an op-ed before. I'd never been on TV before. Before 2020, I think I was on TV once in 2008. My mom watched, so it was, that was something. And so it's a little strange to be on stage. When I said, you guys, I was overwhelmed by your response, it really is something I'm not used to. And it was amazing to me to see so many people come up to me and tell me that my decision that I was going to start speaking publicly has made such a difference. Thank you. So, what I did in 2020 was what I would always do before 2020, which was I ran a little science experiment, right? I asked, in April 2020, I asked how many people had already had COVID. And the way we did it is we just did a survey. It's a study where we got a whole bunch of people to stick their finger out a car window, and we got a little prick of blood from them. And from that, you could tell whether they'd had antibodies. In early April 2020, in Santa Clara County, California, where I live, and then later in Los Angeles County, California, in a second study I ran, also in April, we found that there were, for every person that had been identified with COVID, and were making the news with thousands of people have COVID, it turns out that there were 50 people walking around Santa Clara County, California, that had antibodies to COVID, meaning that they'd had COVID, recovered, but never never came to the attention of the public. The disease was already spreading very, very widely. And it was too late for a lockdown to work. The implication of that study was that the horse had left the barn. Bad at analogies. We were in for a long pandemic. Was the implication of this. And it was very, very clear from those data that the disease as a whole, the World Health Organization was panicking people. It was telling people that 3.5% of people that got infected were going to die. Public opinion polls would routinely say, and I think you still see to the day, that half the people that get COVID are going to be hospitalized. That was a total lie. And yet, you had the top health authorities of the world telling the world that you must be scared of this disease. You must be, so that you treat your neighbors as biohazards. You must avoid this disease at all costs. You must treat your children as biohazards. You must disrupt their lives so they don't go to school. We must close down the entirety of the world's economy. I was born in India. My mom grew up in a Calcutta slum. I have worked, when I was a medical student, I worked in a hospital in rural India. I could see what was going to happen to the poorest people of the world with these policies. It was clear from the very, very beginning that these policies were going to impoverish and destroy the lives of tremendous numbers of poor people. And in fact, in April of 2020, the UN put out a report estimating that 130 million people around the world would starve as a consequence of the economic damage done by the lockdowns. 130 million. Tens of millions of people around the world, the poorest people of the world, did starve. What happened with these lockdowns was that we decided that we were going to privilege the laptop class at the expense of the poor, at the expense of children and the working class. In October, please don't clap at that one. That's just so sad. In October of 2020, I wrote a declaration with the Martin Kulldorff of Harvard University and Sunetra Gupta of Oxford University. Maybe you've heard of it. It's a. How many signed the Great Barrington Declaration? Bless each and every one of you. Oh my goodness, thank you. Almost 1 million people signed it. We got people from 40 different countries that sent us translations for free. I saw tens of thousands of doctors signed it, epidemiologists signed it, Nobel Prize winners signed it, and I was filled with hope because I did not expect that one-page document. I wanted it to make an impact, but I never imagined the impact it could have. The goal of the declaration was to tell the world that there was not a consensus around the lockdowns, that there was never a scientific consensus around the lockdowns, that there were a tremendous number of doctors and scientists who thought to themselves that the lockdowns were a great evil that would not protect the human populations, that would actually end up harming the health of human populations. In response to that declaration, the scientific community decided that they were going to destroy the messenger. Because the real thing about that declaration was, which by the way, it was the least original thing I've ever written in my entire life. It was just the old pandemic plan. It worked for a century of respiratory virus pandemics. It said, don't lock down, do protect vulnerable people, don't harm children, don't harm the working class, don't harm the less vulnerable by disrupting society. Because by doing so, you're going to harm their health in ways that are much worse than the virus itself. And that actually came true. The scientific community responded to that by declaring that I was essentially a class traitor. Dr. Francis Collins, the head of the National Institute of Health, wrote an email to Tony Fauci 4 days after we wrote the declaration, calling me, Martin Kulldorff of Harvard University, and Sunetra Gupta of Oxford University fringe epidemiologists. So when your prime minister calls you all the unacceptable fringe minority, I knew exactly how that felt. And then he called for a devastating takedown of the premise of the declaration. Hit pieces started coming after me, accusing me of wanting to let the virus rip. Well, those words don't appear in the declaration. We called for protecting vulnerable older people by, for instance, home delivery of groceries for free to them, sabbatical time for older workers, so that they didn't have to face what risks of getting exposed we were calling for concrete steps for public health to creatively engage so that the older people living in their community could be protected, rather than a lockdown which had already failed to protect older people. The devastating takedown led to hit pieces on me, hit pieces against my family. It led to death threats. It made it very, very difficult for me to, at many times I wondered, even my beloved university went after me. I was afraid to walk on campus because I committed the sin of publicly saying that there's no good evidence that masking your toddlers protects anybody from anything. So why did this happen? It all started with this benevolent goal of eradicating disease, eradicating all the risk of disease, and yet we're in a situation where that you are told that you need to disrupt the lives of your toddlers, make sure that they can't see or speak. I was getting calls from parents of autistic kids telling me that their kids were harmed by the mask, that it really caused them grief. That I was getting calls from parents of hearing impaired kids telling me they couldn't learn to speak because the lip reading is so important to the hearing impaired kids. The harm done to children was tremendous. And the scientific community decided that they would destroy the careers of any scientist that spoke up. When the head of the National Institute of Health does something like that, what he's doing is sending a signal to all the other scientists who depend on money and social status conferred by getting grants from the National Institute of Health, that if you step out of line, we're going to demolish you. What they were doing was trying to create an illusion of consensus in favor of the lockdowns, to lull the public into thinking that they were still the good guys. And in fact, a central element of the pandemic response was that you had to tell the public, you had to show the public this, everyone agrees, because what they asked you to do was absolutely extraordinary. They asked you to disrupt your lives, to treat each other as biohazards in a way that should never have been done, and could only be accomplished if every single legitimate scientist in the world agreed, right? But every single legitimate scientist in the world didn't agree. And who the hell cares what legitimate or illegitimate scientists say when it comes to hugging your kids? You hug them. I'm going to hug my kids whether the scientists say so or not. So how does an illusion of consensus get created? Well, first you destroy the scientists that stick their necks up. The second, what about, did anyone ever get censored on YouTube, on Facebook, on Twitter, on like, you know, you put up, anyone have put like a little tweet out, an innocent tweet where you link to a study or whatever, and then all of a sudden there's this like thing that says you've spread misinformation, like the little, or the worst is like a link to, for more information about COVID, see Health Canada, like that. It turns out that that was not simply something done by the tech companies. I'm a plaintiff in a lawsuit brought by the Missouri and Louisiana Attorney General's office. And it's called the Missouri versus Biden case. In that case, what we found, we got to depose Tony Fauci for 8 hours. It's tremendously entertaining to watch him say, I don't recall, 179 times. In that case, we uncovered evidence that the government, the American government, was going to social media companies, giving them lists of people and ideas to censor, and in effect threatening the companies that if you don't censor these people and these ideas, we're going to destroy you. It was not an organic decision by many of these companies. I mean, some of them might have done this anyways, but it wasn't an organic decision. The government used its power to create an information ecosystem that looked like we were the fringe minority when we were not actually the fringe minority. I agree with Zuby. The term elite doesn't belong to them. It belongs to us. Right now, the case is sitting in front of the Supreme Court, and we're going to hear whether the United States still has a right to free speech. I'm afraid I have to say, like sitting in Canada, I don't think that you all have a right to free speech. And okay, so we're now on the other side of this. I think the information ecosystem has changed pretty substantially. Could you imagine holding this conference 2 years ago here? Right. So that points to what we have to do going forward. Right. The pandemic, in some sense, is over. But what's not over is the creation of this tremendous group of people that understands that what we went through was deeply wrong, that there were no checks and balances where there should have been, that the people that we trusted to take care of our health failed fundamentally. And they did it in an autocratic way that had actually nothing to do with health and everything to do with power. What we need is a reformation of our public health infrastructures, the regulatory bodies that govern the drugs that we take, the decision-making authority over whether you can go to church, you can go to your synagogues, you can go to your mosques, all of those decision-making authorities do not belong in the hands of public health. Your businesses do not belong in the hands of public health. Public health that tells you that you are simply a biohazard is bad for your health. We need to democratize public health, and we need to restore our democracies so that we have the power to speak as a fundamental civil right, which I thought was unquestioned, but very clearly is not. We need to retake our democracies and enshrine in them at the center a democratization of public health and a fundamental restoration of basic civil liberties like the right to speak. Because you know, the most important thing that is necessary for your good health, it turns out to be free speech. Imagine a pandemic where you could equally speak alongside the neighbors that were spewing fear. Right? Imagine that every time you posted a study that was somewhat good news, you wouldn't be called a dangerous what is it called, fringe individual. These are terms for the past. Imagine a future where the pronouncements of scientists are checked by knowledgeable people, so that scientists no longer have any opportunity to rule over you, which is what happened during the pandemic. Imagine that future, and this conference is the beginning of that, and I'm so glad that I was invited to come, and I'm so pleased by the opportunity to meet all of you. Thank you.